Have everybody. Good morning, everyone. I'm Hartford HealthCare's Tina Barona, Director of Media Relations. Thank you so much for joining us this morning on this 1-year anniversary of our first COVID-19 vaccine that was administered at Hartford Hospital a year ago. We are so excited to join our experts with all of you today. We have Dr. Ajay Kumar, our Chief Clinical Officer here at Hartford HealthCare. Keith Grant will be joining us in just a second. He will be logging on here. Eric Arlia, we have with us, our Vice President of Pharmacy Services for Hartford HealthCare. And alongside him is Dr. Melissa Cumberland. She is Chief of the Department of Medicine at Wyndham Hospital and also one of the first healthcare providers to receive the vaccine 1 year ago today. Just a reminder, housekeeping reminder, if you have questions, we will get to them after all of our speakers have had a chance to give their opening statements and introductions. We will have a Q&A at the end. If you have questions, write them in the chat and we will ask them in the order that they are received. So thank you all for joining us again. And I'm going to turn it over to Dr. Kumar.
Thank you, Tina. Good morning, everybody. Well, it's nice to have everybody back exactly after 1 year since we gave the first vaccination in Connecticut. We've come a long way in the last 1 year in many ways, but still the concern about the COVID still lives with us. We are still seeing increasing numbers in the hospitalization. However, we're going to go over the details about what's on the horizon and how we are still so much to be happy and optimistic about. So let me go through the numbers first. We have 232 patients in Hartford HealthCare today, 28 patients in Bacchus Hospital. Charlotte Hungerford has 17 patients. Hartford Hospital has 67 patients. Midstate Medical Center, 26 patients. Notchog has 2 patients today. St. Vincent Medical Center has 29 patients. Hospital Center, Connecticut has 53 patients. And Wyndham Hospital has 10 patients. Now, these are the numbers which we are seeing somewhat of a slow increase every day for the last several weeks now. We think it's going to continue to rise at the moment and hopefully settle down sometime in early part of January when we start the plateau and see a decline. Now, just reflecting back last 1 year, exactly on December 2020, on this day, we had 340 patients in across the Hartford HealthCare. So I'm a glass half full kind of a guy. So if you look at the numbers, it is still lower than last year. And the peak we had in Hartford HealthCare was in April 22nd, 2020, when the first wave had hit the Connecticut, and that was 425 individuals at that time. Now, in the last 1 year, we've learned a lot, we've done a lot, been available to each other as well in many ways. But one of the most important landmark gift of science we've received in this pandemic, and probably for the longest time in the mankind history, is a vaccination against COVID, which has protected and saved a lot of lives. I have the pleasure of having Dr. Melissa Cumberland joining us today, who was one of the first recipient of vaccination among the provider group. And I'm going to have Melissa talk about, reflect back on last 1 year's journey and how she looks back and while managing the patients, I believe today as well. So Melissa, I'm passing on to you. Thank you.
Thank you, Dr. Kumar. Good morning, and really thank you so much for asking me to join this forum. Over every once in a while, over the past almost 2 years now, I try and describe or look for a word or a phrase that describes just really what everything has really meant to me, how has everything felt. And the best I can really come up with is it's surreal, because it's been quite an emotional roller coaster, right? It was exciting last year to be one of the first members of this leadership team to really receive the COVID vaccine. And it continues to be exciting today as we're now able to celebrate yet another milestone in our country's fight against COVID. And that milestone being, as you said, 1 year ago today, we received our first dose of the Pfizer vaccine. So that's definitely an exciting moment then, and still continues to be an exciting moment in the celebration now. over the time, I've been proud of our patients and our community members for really trusting us, trusting medical professionals, trusting the science behind the vaccine. These same community members have, they've had themselves vaccinated. They've encouraged their family members to be vaccinated. And I'm really proud of not just them, but also our colleagues for advocating for the vaccine. So I had several proud moments during this course since the rolling out of the vaccine, to really say that we've banded together, and all of that really allowed us as a community to have a somewhat or close to normal summer for 2021, much different than 2020, right? But I will admit there were definitely, and still continues to be, levels of frustration. We do, as providers, are frustrated maybe when we see that a patient has contracted the virus from not practicing social distancing, not masking, or not being vaccinated. So, and there's definitely also, there were levels of frustration when it came to the realization of what the healthcare disparities that existed that may have impacted our vaccination rates or the access to our vaccines. And I'm very proud, again, of our colleagues and being a part of a healthcare system that really has done an amazing job of pooling resources to try and improve access to the vaccine and assessing the disparities in our community. There's definitely been areas of fatigue and exhaustion. Physicians and nurses are tired, right? Because it's been a long fight, and it's not over. But I think through it all, and through all out the emotions and the roller coaster, the one thing that's always stood out with whether it be leadership, whether it is our physicians, our nurses, the one thing is that month to month, we've been able to see just how much stronger we really are, the resilience that has come about. We didn't think that the resilience is really the track of that emotional roller coaster. We never ran out of track. We never lost track. We never lost our resilience. And so I continue to be proud of that milestone, proud to celebrate what we're doing, what we did a year ago, what we're celebrating today, what we'll continue to celebrate, because there will be other moments like this to celebrate when we stick together and when we do the safe thing. And so, long and short of it being that, as much of maybe a roller coaster as it may be, we've done a great job, and we should be proud of where we are. And as Dr. Kumar said, being the half full kind of person, we're in a better place this year than we are last year, where we were last year. And if we continue to do that fight, if we continue to stay together, we'll continue to be along the same track of building resilience, being together, increasing our vaccination rates. And so that's, I guess maybe the long or short is it's surreal, but at the same time, it's been something to celebrate.
Thank you, Malaysia. Thank you for sharing your personal reflections. As we're talking about the hope, there's so much we have gained in the last 1 year, despite all the losses. And some of those things have been the scientific achievements and therapies and monoclonal antibodies and other things. And I'm going to point at Eric to just walk us through about the tools we have in our toolbox to help patients out. Eric?
Sure. Thank you, Dr. Kumar. Good morning, everybody. It seems like every week we learn more and more about the tools we have, the progress that we're making with those tools. I mentioned last week we had a brand new monoclonal antibody approved, a little bit different than some of the others. This one was designed for people who either can't take the vaccine because they have severe allergic reactions, or they aren't able to have an immune response. A good example of that are people who have had transplants and are on immunosuppressive therapy. So that's a new monoclonal antibody that we're hoping to have within the next week here in Connecticut and at Hartford HealthCare that can be used for that population. We have 3 other monoclonal antibodies that are currently available and still in good supply that are used to treat people who have had an exposure, or for people who are at high risk for severe disease that have been exposed as a post-exposure prophylaxis. So we continue to administer those in many of our hospitals around the system. We've definitely seen an increase in the availability, in the demand for those products. I'd say probably in the last month, we have seen the demand and how many we've administered per week almost triple. So there's definitely more acceptance out there of getting those monoclonal therapies. In terms of the vaccine, I'll remind everyone that we still have plenty of vaccine available for people to get boosters. It still is our best. That's still our number one weapon in our toolbox that's available to us today. If you have not already done so, if you've had your primary vaccine series, if it's been at least 6 months with Pfizer or Moderna or 2 months with Johnson & Johnson, really strongly encourage people to schedule that booster dose. It's a one dose commitment. You don't have to come back again in 3 or 4 weeks. It can be very quick. Here on the 14th of December, it's still time to boost your immunity before the Christmas holidays. And then the last thing I'll touch on, we're all eagerly anticipating emergency use authorization for probably the first 2 oral therapies to treat the COVID. They still aren't approved yet, but we're hoping sometime in the near future. I noticed this morning, there's some news reports that the Pfizer product has confirmed an 89% reduction in hospitalization. That was what they had in their preliminary data that was released about 4 weeks ago. So as they've continued to validate that study, it looks like it's holding true. So that's very, very exciting. That's something that will be, once it's available, once it's authorized, we'll be working very hard to create a process to very quickly get that drug into the hands of people who have been exposed, because those drugs all work best if you have, if you can catch it within the first few days of disease. So again, we learn a lot of things every day. I don't know that I could have realized a year ago that we would continue to have this much new information available to us each day, but it's been an incredible, exciting journey. I remember everything about that day on December 14th. I remember the weather. I remember the media presence there with Dr. Cumberland and others, and Keith getting their first doses of the Pfizer vaccine, and how exciting it was to mix the first vial of the vaccine, and how nervous I was to do it, to be honest with you. But I'm so happy. We've come a long way. I checked this morning. We have administered 526,000 doses of vaccine just in Hartford HealthCare. And I know how much incredible discretionary effort that has been for all of our staff. It's probably one of the most important things we'll ever do in our healthcare careers. I know many of us in pharmacy feel that way. And we're just going to continue to learn, and we're going to utilize what's made available to us week by week and do everything we can to get all of these therapies out to patients in need.
Thank you, Eric. And last but not the least, Keith Grant, who's been a source of education, a lot of optimism and guidance to entire state, and definitely to Hartford HealthCare. Keith, love to hear your thinking about infection preventions and other things which you have experienced being so connected with the community in Connecticut.
Absolutely. Thanks, team. Thanks, Dr. Kumar, for your absolute leadership, and the entire team at Hartford HealthCare. And many times I get on, I thank Tina, Melissa, Rebecca, and the entire team to ensure that whenever there's something for us to speak to the community with, that opportunity is avoided as soon as possible. I think the journey for infection prevention, the most positive thing for us is the fact that through this disease process, we've been able to develop many infection preventionists across the state. There's things that every individual, every household know about infection prevention that will protect them, not just with COVID-19, but other disease processes. And we've seen it with the reduction in numbers in the flu, in influenza across the state, across the country. So we've done, I think, a wonderful job in trying to get individuals educated. I think in regards to the epidemiology and our current infection prevention practices, we are at a significant point. I do believe that, if you look at data of the impact that we have when we are disciplined and compliant with our processes, such as our masking and our social distancing and so forth, and identifying our symptomology quick enough and getting tested, the data shows a significant impact on this disease process, and it pushes the epidemiology down. The interesting thing is, as much as we've learned, the few things that's remained consistent is these mitigation strategies. And it's very important as we go into the holidays to protect ourselves, protect our families with these mitigation strategies in place. The last thing I'll talk on really quickly is we have a lot of discussion about the Omicron variant and the impact that we expect it to have. You know, we track generally from an epidemiological perspective close to the UK, and we are seeing a significant increase of that variant in the UK. Not saying that's what we expect to happen in the US or in Connecticut specifically, but again, we've tracked pretty much, I think, 6 to 8 weeks behind them in our epidemiology. Currently, they're at about 44% to 44 to 50% of their new cases are Omicron, and we're currently still at about 99+% with our data being Delta. I can't stress enough, we've seen, and I'm sure Dr. Kumar has spoken about this before, we've seen an increase in hospitalization. We've seen an increase in clusters throughout the community. But you know, it remains consistent where in the population that this disease focuses on is our unvaccinated individuals or older individuals over 65. So be mindful of your community, be mindful of your elder colleagues, your elder family members, and so forth, and be careful throughout the season and implement those practices, social distancing, wearing your mask as much as you can, get vaccinated if you haven't, consider getting the booster if you qualify for it at this point in time and you haven't. And again, enjoy the holiday as it comes.
Thank you very much. We do have a lot of questions coming in from the media in our chat, so I want to make sure we get to all of them. I'm going to start first with Tracy O'Shaughnessy from the Waterbury Republican American. The UK has had its first death from Omicron yesterday and added more people to the hospital ages 10 to 85. The majority had 2 doses of a vaccine. What does this tell us about the efficacy of current vaccines against Omicron? And what does this tell us about Omicron as a disease? Keith, we'll start with you.
Yeah, so, you know, we talked about this, and I know Dr. Kumar did a really good synopsis, I think, the last time we met with the team. We're still looking at data, so we're still appreciating the data. But the more data that we've seen, the more consistent it is with the concerns that we had regarding where the mutations were happening. So the mutation for this variant seemed to be happening on the spike protein, a significant amount of mutation. For us, why is that concerning is because the vaccines that we do have is built based on that connection of the spike protein to the human cell. Now, with that being said, with Pfizer, the Pfizer research or data that came out, I'd say about 4 or 5 days ago, coupled with a set of data that came out with the Israeli health system study, showed that there is significant benefit from getting the booster. However, it does also show that with individuals who's been vaccinated for greater than 6 months, the vaccine might not be as effective against the Omicron variant. So we do have that set of data. Again, there needs to be bigger cohorts in order for us to really make significant policy changes around this set of data. But based on what we're seeing right now, our concerns are very consistent with the data that we've seen through the South African studies, the Pfizer study and trials, and the studies that are coming now out of the UK and Israel.
Dr. Kumar, do you want to add anything?
I think we need to trust what we have right now, the vaccines and our precautions and our knowledge we've gained so far. Let's not, we will keep an eye on the Omicron, but it's too early to comment with one individual death, the implication it has, large implication it has. Any variant which comes along poses a challenge. But I think the most important thing to know is that we know what to do. We've experienced it. We've got tools in our toolbox to manage that.
Our next question is to Dr. Cumberland. Has it been difficult for you as a provider to treat patients who are unvaccinated? How does your staff fight off feelings of frustration? That's from Tracy at the Waterbury Republican American.
Thank you, Tracy, for that. It's funny because I say that we are frustrated at times when we see those patients, but if we take COVID and put it as any other disease process, because as physicians, we see patients that have any other illness, any other disease. We see them, and some of them are not doing what we feel is the best thing, right? They're not necessarily taking care of themselves in what we feel are the best ways. And what do? We continue to treat them. We continue to treat them the way that we feel is the standard of care for them. So despite it all, and no matter what the feeling may be, it doesn't mean that we don't do the safe thing and we do the right thing. So we do continue.
Our next question comes from Eliza Fawcett from the Hartford Courant. Are you concerned about testing availability, both in terms of at-home tests and PCR tests, drive-up sites? Currently, it seems Hartford HealthCare only has one drive-up site. What would it take to make testing more widely available, especially amid end-of-year holidays? Dr. Kumar, do you want to start with
Eliza,
that?
that's a great question. Since the beginning of the pandemic, the testing has been a point of discussion and focus, and Hartford HealthCare has stepped in, providing the access when there was no other access available. Right now, there's a wide variety of access for the testing through different channels, different means, different labs as well. Obviously, it needs to continue to be monitored. We need to continue to provide more access. But we're not hearing any concerns majorly, and I would love to know if you have any feedback about the lack of access on the testing side, at least for the community members. And if there's one, Hartford HealthCare will always step up and support that out. The effort we have right now is available for our, obviously, colleagues in our community, but we can always relook into that.
A follow-up question from Tracy to Eric. If you are saying the demand for monoclonal antibodies is almost tripled, is that for hospitalized treatment or as a preventative measure?
So the monoclonal antibodies are meant for people who are not hospitalized. So that demand is strictly for patients who are either COVID positive or have a exposure to a patient with COVID and have severe risk of having severe COVID. They're intended to be outpatient infusions that we do either in our emergency departments or in a clinic in our hospital. We're currently looking at changing that and moving into some other areas to administer them as well. But those are patients who we're trying to keep out of the hospital, and that the monoclonal is an intervention to prevent them from reaching that level. So that's 100% on the outpatient side.
Question from Alex Putterman at the Hartford Courant. Beyond promoting vaccination and booster shots, what can the state do to slow this recent COVID spike? What role do masks and social distancing play at this point? Keith, do you want to start?
Yeah, so I think, if you look at the data of where Connecticut is, we're consistent and relative to all other states. Connecticut's done a very, very good job. And I think, Dr. Cumberland spoke about the collaborative efforts with the community, but with the health system, with the state and local government. We've done a significant amount of work in ensuring that the right messages go out and the right policy and processes are in place. And I think we continue to collaborate well. They've generally, not just the governor, but his team generally react to the science of it all. And I'm sure from an epidemiology perspective, he's getting conversations and having concerning conversation about what's the next step. So I do believe the processes are in place right now with the history that we've had and the learning that we've gained, the knowledge that we've gained to make safe, concerted decisions as individuals. And I do believe, the responsibilities of the state has been portrayed and displayed over the last few months. And I trust in that process at this point in time.
Dr. Kumar, anything to add?
I think, no, Keith summed it very well. Thank you.
All right. Nicole Leonard from WNPR. When booster shots first became available, you mentioned there was a slower uptake even among healthcare workers compared to the initial series. Do you have an update on how booster shots are going now among staff at Hartford HealthCare? Eric, do you want to start?
Yeah, we are tracking the boosters amongst our staff. It's definitely been increasing. I don't recall the latest number. I want to say it's around 30%. I don't know, Dr. Kumar, if you have the latest number from the team.
It's Eric, I think our healthcare workers numbers are definitely more than 40% right now. Actually, the last number I saw was last week. Nicole, I don't have exact data for the Hartford HealthCare right now. We are assessing the data. Interesting part about the booster for you to know is that there are so many access points for the boosters right now. You could go to different areas, pharmacies, and other places to get the booster. So data reconciliation becomes a challenge, even for our colleagues as well. But really important to know the booster is widely available right now in a variety of settings in all area. And I'll just piggyback on the question, which I believe Grant is asking regarding the equity aspect. And I would respond to the same thing, is that the availability of the boosters in all the community, through the pharmacy, through Walmarts and other places, is quite good at the moment. So at least I like to believe that the state is well covered and the access is not an issue. The acceptance is a different story. And I think we continue to have to do a work on that part here, is that we need to educate people. We need to folks to know the boosters will protect them through the Omicron and waning immunity at this time. So that's something I know the state is putting a lot of effort, Hartford HealthCare is putting an effort into that. So we all have to continue to do work to educate people around us.
And Dr. Cumberland, you did mention the community aspect and the importance of that. Do you want to respond to that question as well, to the equity question?
Yes, I do piggyback off of Dr. Kumar in terms of, the education. I think that, our struggle and where we've had opportunities as well as successes since, the initial rollout in December is educating the community, but not just educating, but also gaining the trust of the community that they should, in their best interest, in their family's best interest, for the sake of their health, be vaccinated. And the communities have done well in receiving us. I think we've done a better job than maybe some of us thought we were going to be able to do. But there's opportunities no matter where we go, right? So Hartford HealthCare has done an amazing job of really opening up the access to our vaccinations and our boosters. But I don't think access is as much as an issue as much as let's educate and let's keep trying to build the trust within our community so that more members get out there to get vaccinated, get their boosters. And they've done a good job, but they'll continue to do. We need to do more, and we will.
And speaking of doing more, Dr. Cumberland, you have done more. The past year, you have volunteered your time into the community, going to your local church in Bloomfield to volunteer your time and administer vaccines to churchgoers. And I think you bring up a good point there, because you talk about the trust factor. And I think if you can maybe elaborate on that a little bit more, and going into the communities and you volunteering your time to give those vaccines, to stress the importance of those relationships and building that trust factor.
Right. It's easy to say it. And I think our whole leadership team knows that we can say it, but until we show our face, until we get out there, until we roll up our sleeves is when you start to really hear and have the conversation with individuals within the community, whether it is something that you're bonded to, such as me with my church, or, just going to any local center and doing these vaccines. But when you're there, when you're in it, is when people really believe it. Right. And because they know that you're standing by your word. And it was important for me to do that. I had lots of conversations. I've had, with people, whether it be in line, what do they tell a family member at home that may not trust it, and they brought them back. And so, when I see those things, I know that one person, another person, and, we'll keep building the trust within the community, and we'll keep increasing our vaccination rates. But I think the trust factor was huge in the beginning and continues to be huge now. And we've done a great job of trying to make sure that we get out there and really show that we stand behind this vaccine.
Thank you for that. And thank you for volunteering your time on many of those occasions back then. We appreciate it. Eliza Fawcett from the Hartford Current, a follow-up question. How important is testing availability at this stage of the pandemic?
I'll address Eliza and Tracy, your comment, both of them. Testing is very important. And I think I don't suggest to minimize access to the testing at all. It's really important for us to be able to assess what the prevalence is and to react accordingly as well. I think, and I really can't comment what's happening in the Massachusetts. I haven't studied the Massachusetts all that well. But between two large healthcare systems in the state of Connecticut and with other hospitals and a variety of labs, I think there's a fair amount of access in Connecticut on the testing side. Can it be more? Probably. Could it be more convenient? Possibly. But I think where we are right now, we are in a pretty reasonable place. It can always get better, and I think that's where all of us are looking for new type of tests and new type of technology. Some of the concerns we have, and the Connecticut has been very cautious in adapting the test. Some of the cautions we have, the false positives and negatives, which creates more confusion in the data and creates more challenges for us to manage. So I think all in all, at least from my perspective, we have an access, we have supply, and we're meeting the need at the moment of what's happening in the community.
The question from Alex Putterman at the Hartford Current. In your observation from being out in your communities, do you think enough people wearing masks and taking COVID risks seriously? Dr. Cumberland, do you want to start with that?
I do believe that the community has done they've done a great job of continuing to mask and trying to practice social distancing. You do run into spots of where that's not necessarily practiced, but I think that people are tired, just like we say healthcare workers, right? They want back their normal holidays. They want to be able to go out and still really congregate with family and friends, because it's been, as I said earlier, just a long fight. But the community has done a great job at masking. We can always do better, though. There is always an opportunity to do better. And I think that's where we come into play to try and advocate, to continue to advocate that. But from being out there so far, what I see is that the community continues to do a good job, but we just need to do better.
Keith, your thoughts too, I'd like to get, and I know you have to run, but you're out in the community a lot. What's your take?
Yeah, I mean, it's interesting because, when we're at a point that we have high prevalence, we have more people focusing on these things, right? And we talk a lot about people getting back to normal. And I think normal needs to be administered as safely as possible. And, one of the discussions that we've had is how do we communicate that, saying wearing your mask as much as possible, but getting back to normal as much as possible. And I think we're in that very delicate space at this point in time. What I will say, and I continue to say, is individual risk assessment. I will see if you're in a certain situation that you have multiple people that are closer than 6 feet within you, to protect yourself and protecting people, you should be wearing a mask. And that's what we're seeing in the communities. That might be falling off just a little bit. But I think overall, having said that we have some opportunities, I think we're doing some good job.
Question from Tracy. Speaking of the trust factor, we have readers who assert that the drug ivermectin should be available to U.S. residents as a prophylactic. What can you tell us about that? Keith, maybe we'll start with you and then Eric.
I can.
Go ahead, Eric.
Yeah. So, it was normal and natural for many drugs that are currently on the market that, there was some theoretical possibility would help to treat COVID to be reviewed and evaluated. And I think the reality is that some drugs that were on the market for different uses, things like prednisone, some medications that we use to treat rheumatoid arthritis have found a place in therapy in the COVID process. Ivermectin is a product that was looked at and was evaluated, but really hasn't stood up to the scientific process of study. So I think we have much better options. We have more new drugs coming out that are being studied and are, holding up. As I mentioned earlier, there's a really promising oral drug coming out from Pfizer, hopefully soon, with an 89% efficacy rate. It would be nice if a drug that was already available had such positive results, but they didn't really pan out for ivermectin. So, I always just encourage, the process of vetting out drug therapies through well-designed studies is how we find our most effective therapies.
All right, those are all of our questions from the media. I do want to take this time for final thoughts. Eric, final thoughts?
Yeah, I just, again, want to, thank everybody for all of their efforts over the last year. I know it's been a lot of work for many of us in healthcare, but it's been a journey with great rewards as well. And I want to just remind everybody to be vigilant and to hang in there because we learn more things every week. New options become available. It seems like right now we're in a time of a lot of activity, which is exciting. It's a lot of things for us to work out and plan, but at the end of the day, it's going to mean we have more options to help people. So remain vigilant and continue to follow the development with some of these new therapies. And we're really excited, to really build on what we've been able to do with the vaccination effort to continue to combat the pandemic.
And Dr. Cumberland, you were one of the first to receive your vaccine. It was all we had last year was the vaccine, which came in record time in about 9 months, which was impressive. But now today we have so many more tools in our arsenal. Tell us your final thoughts.
My final thought is the same as it was last year. Stay social distance, stay masked, get vaccinated, advocate for those who, to those who are not vaccinated, educate them, stick together. We did a good job. You can see the decrease in the numbers from one year to the next. We've stayed strong and resilient, and we've made an impact, right? We've had an impact on the community. So I would say stay masked, social distancing, continue to stay together, support each other, and we'll get through this fight.
Well said. And Dr. Kumar.
I come from the place of hope, and there's so much to be thankful about, so much to be hopeful about, despite all the challenges we've gone through as a society, as a community in the last 18, 19 months, and more challenges to come. The most important thing for us to know that we are in this together. I think the healthcare system like ours is always there to support the community. We remain open, we have access, we are safe. We are allowing visitors and patients to come for their medical needs. We have supplies, we have knowledge, we have resources, we have new technologies, we have new drugs and therapies. There's so much to be hopeful about at this time here as folks actually enjoy the holiday season. My only request would be to stay safe. As Dr. Cumberland mentioned, mask, social distancing in appropriate locations. We are almost there at the finish line. And I think I said that somewhat of the same nature last time as well. But we can't let it win at this time here with all the things we have achieved and done together. We are going to get through this, all of us, with a bit of a pain, but we'll get through this. So I'm hoping that all of us will remain hopeful and remain safe. Thank you.
Thank you, Dr. Kumar. Thank you, Eric. Keith, I know, had to hop off, and Dr. Cumberland. Thank you all for sharing your time with us and to the media for watching and for asking such great questions. We appreciate it. And stay tuned. There will be more to come as we continue on this journey. So thank you all for joining. Have a great day.
Thank you.
Thank you.
Thank you.
Thank you.